The key takeaway of this study is that in people who have coronavirus, who may not actually be that sick when they're acutely infected, they may then go on to develop long-term symptoms of COVID, including fatigue and loss of taste or smell. It's common, and it's common not only in those who are sick enough to be in the hospital, but also in those who were mildly ill or really weren't sick at all. They were diagnosed, they had very, very mild symptoms, but they didn't even ever require being seen in a clinic or in the emergency department. This is something that's seen across multiple geographic areas among a diversity of populations. Here in Seattle, we have a pretty small cohort. It is the longest cohort in the United States, and we did follow them out to 6 to 9 months. And so I think that will become available, that type of data will become available across the United States as other cohorts are being followed up. And I think a comparison across the US and across the world will be really important, and that'll help us tease out the risk factors for developing long COVID. And then the question is, what is driving this? What are sort of the phenomenon that are associated with development of long COVID? Is this some sort of immune activation, some sort of inflammation, some sort of development of autoimmunity that's causing all of this? So we have the blood samples from these patients. We'll look at those samples and try to tease some of this out. There's always this phenomenon of post-viral illness that people do develop, that after they have a viral infection, that some people would then go on to develop lingering effects. And this is what this post-COVID syndrome is looking like. But up until now, we've never had the numbers of people or the proportions of people who have had these types of long lingering symptoms. And there hasn't been sufficient research to understand what causes it or to develop ways to treat it. So I think that will all come over the next couple of months to years. But in the meantime, the first thing to do is just to quantify it and to describe it. That is the sense I get from the young and healthy people, this very young group, that they get sick and then they get better and they think it actually isn't that bad of a disease. And what's clear is that you can do well initially, but then you can, over time, then develop symptoms that are quite crippling in terms of fatigue that makes it hard for you to just do your normal activities, or not being able to taste or smell, which is it has a significant impact on your quality of life. I think that the key is to, obviously, until the vaccine is available for this age group, and it will be months still, that they do need to be cautious and to take the precautions to keep from getting COVID, because it's not just the short-term symptoms, but this potential long COVID.
These individuals were enrolled as a part of the Harvey study, which actually started back in 2016 to look at acute RSV and influenza infection. But when Seattle became the initial epicenter of the pandemic in the US, we quickly pivoted to look at COVID-19. And so to date, we've enrolled around 300 individuals into a longitudinal cohort, and we're interested in looking at kind of the clinical outcomes, immune responses, and long-term effects of COVID-19. What we saw was that 30% of our cohort reported a worsened health-related quality of life compared to baseline, so before they got sick. And additionally, 8% said that they had faced impacts to their activities of daily living. And the most common one was being able to perform their household chores. A lot of this was attributed to fatigue, so people being able to, carry heavy objects, unable to, stand or walk unassisted for long periods of time. And so, with this, I think we're going to have to start looking into what kind of help these people are going to need to, overcome this fatigue and kind of get back to their normal way of life prior to when they contracted COVID. I think one of the strengths of our study is, at least when we were writing this paper, is that to our knowledge, this presents the longest follow-up symptom assessment of effects of COVID-19 post-illness. Our participants were at a median of around 6 months when they filled out the survey, and the longest time frame that we had was up to 9 months post-illness. The most common were fatigue and loss of sense of taste or smell. We had about 14% of participants say that they were still experiencing those symptoms, at that median of 6 months post-illness. We did actually see that the proportion of individuals who were reporting lingering symptoms did increase with age. So between the ages of 18 to 39, it was about 27%. And between 40 to 64, it was 30%. And then 65 and older, it was about 43% of individuals.
For this study, we surveyed a population of our cohort, asking them if they were still experiencing symptoms from their acute infection or if symptoms had developed in the interim. And we really just wanted to see what was present, and the unique characteristic of this cohort is that around 90% of them were not hospitalized due to infection, so they had what we would consider a mild or moderate illness. I think our cohort and this study specifically are unique just because of that. There's been a lot of focus on hospitalized participants so far, and we are looking more at participants and folks who are normally infected and who did not have this large acute illness. So in terms of impact on your average person who wasn't hospitalized, this shows that there are potential consequences that could last beyond your acute illness, even if you don't go to the hospital, even if you aren't really sick from that COVID-19 infection. A high proportion of our cohort reported a worse quality of life or worsened quality of life after their infection. And that's understandable given the burdens that come with that illness. And we understand that there are a lot of hardships right now, and it seems that the symptoms from and everything surrounding their infection can add to that. For the people who experience really severe long-term effects, they have massive impacts to their quality of life, to work, to being able to function day to day. And our study didn't necessarily focus on that specifically, but I think it's an area that needs to be actively researched. With UW setting up the long COVID clinic, I think it's a start to kind of assess widely what it's like for those people, but they're going to need a lot of support to help overcome their symptoms, and having symptoms persist for 6 months after an illness is pretty remarkable.